Welcome to the second Mandela Washington Fellows Reunion meeting. And we met last time on August 31st. And we're really happy that we have this meeting again, this time on October 5th. This is our first formal meeting. Last time we were trying to have a get together, try to reacquaint ourselves. And there were about 33 fellows who were able to make that meeting. And today, I hope that we'll have about the same number of people coming in. And then we have to spend the next 90 minutes to talk about how we are doing during COVID-19 as managers and leaders of our institutions and of our work. Some of you are also studying right now instead of full-time working. So I also want to suggest that some of you are also having some disruptions in your studies as well, and not just work. So the way that we're going to run this meeting is that we'll spend the first 30 minutes to 45 minutes for some presentations, and then we'll have breakout rooms for about half an hour, and then we'll report it out after the breakout sessions. So I'm very pleased to introduce our first speaker. Our first guest is our provost, Dr. Karim Ismaili. And some of you knew Dr. Ismaili very well if you were a 2016 fellow, and he was very much the first organizer of the, or leader of the Mandela Washington Fellowship Program in 2016. And then some of you also met Dr. Ismaili in other meetings and sessions in from 2017 to 2019. As you know, Dr. Karim Ismaili is the Provost and Vice President for Academic Affairs at Bridgewater State University. He came to Bridgewater about 7 years ago, first as the Dean of Graduate Studies, and also the Vice Provost and Interim Provost for Academic Affairs. And then and also as well as the role for the Special Advisor to the President for University Priorities and Global Engagement. And Dr. Ismaili has been our Provost since last year. And in this role, as the Provost and Academic and Vice Provost of Academic Affairs, he's our Chief Academic Officer. And he oversees all our academic programs. He set and implement the budget for the division. He lead our strategic planning. He worked with various constituencies to advance student success. And he also proposes and implements innovation throughout the division, establish outreach and access initiatives, cultivate experiential learning opportunities, and support excellence in teaching, scholarship, and creative work. Dr. Ismaili, in other words, is the leader for the whole university in advancing our academic mission of the university. More recently, because of COVID-19, Dr. Ismaili has been asked by President Fred Clark, to be the head of the COVID-19 Safe Return Task Force. So we have invited Dr. Ismaili today to talk about how BSU is doing in reaction to COVID-19, in dealing with COVID-19 and the crisis that is brought to Bridgewater State University. Without further ado, let's welcome Dr. Ismaili. Karim.
Thank you very much, Wing Kai. I'm flattered that you thought that I was here for a year in the role. It's actually my 5th year. So I think that I'm still fresh, maybe that's the good thing. What I would say is that, first of all, let me just welcome the fellows. We miss you very much. I hope that this gathering, which is kind of, it's ironic that COVID has given us an opportunity to actually engage in this way. We obviously hope that we can all meet in person again at some point, but this is an important conversation that I know is going to take place today. And we know that this disease is really affecting people very differently depending on where they are. One thing we know is it's at a cellular level, it's uniting the whole world in a challenge. I wanted to just say that, obviously, that the United States, by all measures, really has not handled the pandemic well. All of the indications are, based on simply our proportion of the population in relation to the number of deaths, the number of cases, we are not doing well. And it was only, of course, over the past few days, we've learned that our executive branch has been particularly struck by COVID. And I think some might rightfully point to the lax approach that's been taken around this, or the lack of clear guidance has affected that. That's a separate issue. The question that I've been asked to talk with you about is one that I'm particularly proud of in terms of the way that Bridgewater State University has tried to address COVID-19. And all I would say is that from my perspective, I did provide leadership around how we were planning for our safe return. It's important to note that the words we used were specifically and intentionally put forward. Safety was the key, then it was the return. If we couldn't ensure a safe return, then our return would have been problematic at best. So, what I did was I guided a process, involved key constituencies and individuals across the campus to be able to plan our return in the fall. So just to give you a sense of what happened at Bridgewater State University, in early March, we were, as many institutions across the world, was forced to kind of move away from in-person interaction. So our university and our faculty and our staff and our administrators heroically basically moved all of our operations online. Bridgewater State University is not alone in doing that. We did with great effectiveness. I think that our students and our community actually strengthened as a result of it, because it demonstrated how we could all come together. But that was a crisis, and in the moment, there was no option. The option was clear: we had to move to online modality. But as we moved into the summer, the question facing the university was, as we start to plan for a return to the academic year 2020, 2021, what would our instruction look like? How many courses would we offer in person? How many courses would we offer online, and what modalities would we choose for the latter? And all of these questions were dealt with in the Safe Return Task Force. I think that, what I will do here is I just, in the chat, you'll note that I've indicated a website, and the website provides a guidance or a guideline or a timeline with some information on what we did. So I think if you want to learn about what we did and how we did it, that is still being updated. I recommend that you just click around, look at a few things. Like, it gives you a sense of sort of the comprehensive nature of the challenge that we faced. My role, and I'm really grateful to President Clark for his trust in me to essentially be the architect for the Safe Return Task Force, was to determine who should be involved, what discussions needed to take place, and what would our assumptions be moving forward. So let me just kind of deal with that first. And I'll take it. I want to kind of give you just kind of a broad overview. The first question was, who's involved? Well, it became clear that we needed to have something that was across the university. At Bridgewater, we call it cross-divisional. We needed to have students involved. We needed to have every division of the university engaged. We needed to have faculty representatives involved. We need to our staff and our administrators involved. And so if you start to think about that constituency, those constituencies, we created a task force with about 18 members that represented different parts of the university. So that was the first task. The second task was then for us to think about the key questions that we needed answered. So for example, one of the questions that we wanted to ask was, we're talking about prioritizing safety. What does that mean? In reality, what does that mean for individuals, for the community? Remember, Bridgewater State University, like every institution, exists within a community. We wanted the communities to also feel that we were handling this in a safe way, right? So the first thing we decided was that if we're going to focus on safety, we can't, unlike other parts of leadership in this country, we emphasized that science and data would guide all of our decisions. So that was a key planning assumption, a guiding principle. We recognized that everything we did had to fall into um, an environment of other decisions that were being made in the state, in the Commonwealth of Massachusetts, and also with reference to specific agencies and entities like the Center for Disease Control and Prevention. So that was important. We're a university. So as a university, wanted to make sure that we were prioritizing the high quality educational experience that our students deserve, that we deliver, and to also make sure that we maintained our educational standards and that we were helping students progress through their degree. As with everywhere around the world, we are individuals, but we're accountable to each other. So one of the key principles guiding us was to ensure mutual accountability and collective responsibility for all of our well-beings, both as individuals, as groups, and as a community. The most challenging issue that we faced was trying to create a plan when there was no certainty, and there still is no certainty. So the plan had to itself be flexible, be adaptable, be creative. We needed to recognize that in any given moment, we might have to pivot away from what our plan was, but the plan would need to have some scenarios built into it. So we thought about those scenarios. We knew that communication was really critical, so we emphasized communication. So every week, over a 6 to 8 week period that the task force met from May to the end of June, I provided weekly updates to the campus community on what it was we were thinking through, what decisions were made, all the way to when the task force final report was issued, which again is on the website. The university, as with every institution, had to deal with financial constraints as well. So every decision we made had to think about the budget, had to think about the financial implications of every decision we made, but we had to make sure that every decision was guided by the principle of safety. So we never compromised on safety when it comes to personal protective equipment, when it comes to hygiene, when it comes to social distancing and physical distancing. Everything was factored in, but every other decision we had to kind of look through the lens of our budget. And then we recognized that the only way that we could achieve the goal of having a safe campus where education was being delivered, where our faculty, our staff, and administrators felt comfortable, could only be done if we were all engaged in the process in some way or another. So during the course of the Safe Return Task Force, we created a survey which every student, every faculty member, every staff member, every administrator had an opportunity to respond to. And that became also very important information that helped us build the kinds of information that you see on the website. So the result of this was a plan. And I'm happy to say that the plan actually did become the basis for our collective action over the past 2 months. So we've had a relatively safe return. We've only had 7 positive cases that have been reported at the university. One individual is still in quarantine. That's a 0.14% positive rate. We've had around 5,000 tests. What I would say is that thanks to the vigilance of the entire community, thanks to the leadership of our president, of everyone that is involved at the university, I feel that we have adapted to the crisis as effectively as we possibly could. Are there things we can do differently? Absolutely. I'll give you one example, and then I'll stop. One example is really important. So a lot of our students who come to Bridgewater State University come to the university because of our faculty and the engagement that they have with faculty. What we've learned over the last 6 weeks or so is that some of our students are really thirsting for that engagement, and they're not finding it in courses that are offered asynchronously. So this is where faculty and students are not directly engaged in real time at the same time. So what I've learned is in my role as provost, after speaking with the deans and after listening to students and talking with faculty members, is that for the spring, we want to increase the number of courses that are synchronous, where there's a specific time where faculty are meeting their students, where there's an opportunity to engage together in the community of learning that occurs in a course. And that's something that we, as attentive to as we are now. So as an institution that talks about education, we have to be open to also learning from things that maybe have not worked out as well as they could have. From my perspective, that's critical to the institution, because if we said everything's worked out well, our COVID positive cases are low, people are getting educated, we're fine, we would be a failure. As much as we would look to those metrics and say we're a success, we actually would not be a success because we're failing to learn. So everything that we do from this point on is learning to do things better, learning to continue to adapt, learning to continue to be flexible, and also continuing to have that sense of collective responsibility for one another, that whatever action I take has an implication for me, yes, but also for my colleagues, for my students, for my community. So I'll stop right there. I appreciate the opportunity, Wing Kai, to have this, to be able to kind of begin the dialogue. And I want to say that, just to follow on the theme, I can tell you that as a leader, as an academic leader, I have learned more in the last 18 months than I have over the course of my entire sort of administrative leadership. Because it's only in a time of crisis that you really kind of understand your own personal ability, but also the critical nature of everyone around you to be able to move things forward. Thank you.
Hi, Karim. I think since you're still here, so I think I'll just raise two quick questions from the audience. The first one is, how does the university try to reconcile the national and university guidelines relating to COVID-19? In other words, how we following the state and national guidelines. And then there are questions about how does the online environment affect students' graduation?
Yes.
Whether they can graduate with just online classes.
Yeah. So one of the principles that I mentioned earlier that guided our work was science, public health guidance, and our own sort of data to help us determine what course of action we were going to take when it came to our safe return. So it doesn't matter where you are in the world. We know that physical distancing, mask wearing, hygiene are critical to safety. Now, individual leaders may have different perspectives on that, but if you follow what the guidance is of the overwhelming majority of public health public health leaders, epidemiologists, infectious disease experts, the World Health Organization, it doesn't matter where you go, you're going to find the same thing. So that was the fundamental sort of premise upon which everything was rested. The question about online student progression is an excellent one. So we know from the fact that we've always offered online education that most of our students choose to go online. And as a result, because they've made that choice, they are prepared, if not sort of, they're certainly prepared intellectually for what it is that they've chosen to do. Whether they have the skills is something that our professors and our community tries to help them with, the knowledge that they're going to, they need to succeed. But many of our students who are now in online never chose to go online. It's a choice that they didn't have. It's kind of just, it's what the crisis has brought upon them. So what we have done at the university is try to give as much support as we can for students who are being challenged in this environment, that have special needs in this environment. Our faculty are incredibly supportive in this environment. And we're monitoring through various committees that have been created to create sort of an early warning system that will help us reach out to students sooner rather than later. Because our goal is to have students succeed. That is a fundamental goal of the university. So that's important. And finally, the guidance, the whole issue of guidance. There were moments when our federal guidance was in conflict with our state guidance. But what I would say is we're fortunate that the New England region of the United States has had, in my view, this is my own personal view, pretty good leadership at the state level. I live in Rhode Island, which is adjacent to Massachusetts. Rhode Island, Massachusetts, New Hampshire, Maine, Connecticut. If you look at the states, New York, if you look at those states, we can include New Jersey. All I'm saying is that the New England region and the Northeast region is a region that I think we've been, even though we've been struck very hard in the New York metropolitan area, I would say that, and in Massachusetts as well, in Boston, we've been hit pretty hard. But I would say that our leadership has always focused on public health first. And we know that there's economic impacts, but that has been the guidance. And so the way that we've moved forward in terms of safe return of the economy, of institutions, has, in my view, been very prudent and careful and well done.
I know there's still a question about the relationship with the town, but I'll just leave that to be answered a little bit later so that we can keep the program moving.
Sure.
And I would like to invite Dr. Krisanik to talk about his own perspective. As most of you know, Dr. Krisanik has been one of our most respected professors in political science over the years. And he has been commenting on US government and foreign policy over 3 or 4 decades. So Dr. Krisanik, and then and also Dr. Wendy Haynes, as you all know, was also a political science professor. So I'm inviting both of them to comment on how our governments are dealing with the crisis right now. Dr. Krisanik, Mike.
Okay, there you go. Well, first of all, it's glad to see you all. It's wonderful to see all these smiling faces and friends from a couple of years ago. So hello, and hope we will continue to keep in touch on Facebook and other media. And again, Dr. Haynes will follow me in with my remarks. What I want to do, and not only is this going to be recorded, but my remarks are also going to be part of an attachment that I believe Dr. Toh will send to you also. What I've done is put together what I consider 10 important steps in responding to threats like the COVID-19 virus, and how to deal with crisis and crisis management. So I'd like to go through what I consider these 10 steps, and of course respond at some point to your questions that you may have. First of all, it's important to recognize the potential domestic, environmental, healthcare, international threats that are there. Recognition of a potential problem is enormously important. Rather than ignoring a potential problem, rather than downplaying it, rather than criticizing the potential threat, it's important to be open and clear-headed in terms of recognizing that a threat is either imminent or could be on the horizon at any time. And this, of course, is one of the failures, I think, of this administration, is not to recognize the potential threat that existed. Secondly, is to develop preparatory plans, putting in place, using expert assistance, gathering resources that are necessary in order to develop planning, and to ensure that there is in place a roadmap towards how to properly respond to a particular threat, in this case, the COVID-19 threat. Planning is enormously important, and without that planning, there is very little that can be done in terms of effective leadership, effective response to a particular threat, as I say, in this case, the COVID-19. Thirdly, it's important to put in place the resources, and that means the medical resources, in this case, the scientific resources, and to take the necessary decision-making steps that are necessary in order to move forward with the plan. Clear definitions of responsibility, clear definitions of how leaders should respond are important, how various institutions will fit into this whole process. And coordination is enormously important as well, bringing together not only these resources and leaders, but ensuring that there is a level of cooperation and coordination is important. Fourthly, and this is something that I think is enormously important, particularly in a democratic setting, is to announce to the citizenry and to communicate to the citizenry the scope of the threat and alerting them to the plans that are being put into place. It is important to talk about clear responsibility. It's important to talk about justifying the plans that have been put into place, and to develop, as I say, communication strategies, and strategies that are based on openness, clarity, accuracy, in order to avoid panic and confusion. One of the oftentimes the criticism that has been made with regard to the United States response is the lack of bringing the citizens into this process, bringing openness, clarity, and accuracy to the situation and to the plans that have been put into place. Number 5 is that there always has to be what I consider backup or contingency plans with respect to dealing with the crisis. Again, in this case, the COVID crisis. There has to be an understanding that things are not going to go as planned, that the execution of a plan might not be as effective as many had thought. And so there has to be backup. There has to be contingency crisis management if the problem is going to be effectively responded to. Number 6, and that is the execution of the plan or plans that have been put into place, with everybody on board, with every institution and every leader from various institutional settings, in order to ensure that there is a correct and effective response. It's important to have everyone on board in terms of the institutions and leaders that are there to ensure that there is not individuals who are going to work against the plan or criticize the plan at a time in which it is being executed. As Dr. Ismaili mentioned to you, one of the important elements of any kind of plan and any kind of crisis management is flexibility, decisiveness, and quick action, particularly the flexibility. There are things that are going to go wrong, things that are unexpected, and it's important not only to have a contingency plan, but also to be flexible in response to that. Crisis management is always about the unexpected and the ability to move from what had been put in place to perhaps a new regime or a new response to it, but to have that in place and to be able to ensure that individuals are on board in the various institutional settings that are there. The next, or the eighth, is to be able to respond to public opinion challenges. No plan in a crisis mode is going to be accepted by everyone. In fact, there may be individuals out there who work against that plan, who speak publicly about it, who try to create a problem associated with that execution. And therefore, it is important to have transparency. I'm sure you've heard that word a number of times. It is important also to have respect for these challenges and to respond to those challenges rather than to suppress them. It's important to have a leader and a leadership group that is willing to respond to challenges, answer them, try to create a sense of consensus and cooperation, rather than to try to suppress or denigrate the questions that may arise. Ninthly is to monitor the execution of the plans and to have in place individuals who will have the capability, the expertise in order to see how this plan is working. What are some of the problems associated with it? How must that plan be changed over in a short period of time? So it's important to monitor that plan and the plans that have been put in place. And lastly, after the crisis is over, and hopefully the COVID crisis will come to an end sooner rather than later, is to engage in feedback or engage in an assessment of how the plans and the execution of the plans were developed. What worked, what failed, what needs to be reformed, what needs to be redirected. It's important to recognize with regard to the COVID or any kind of domestic or international or environmental threat that is out there, that there will be a continuation of these threats. They may be different. They may be different than the COVID, but the world we live in now is one in which we cannot ignore the fact that crisis management is enormously important, not only in dealing with a pandemic, but dealing with any kind of crisis in a democratic setting. And so just to repeat some of the key words here: recognition of the problem, preparation for dealing with the problem, resource development, communication, contingency planning, execution, flexibility in the execution, responding to challenges from opposition groups or individuals, monitor the execution, and then engaging in a very vigorous feedback analysis to determine what went right, what went wrong, and what needs to be done in the future. Because as I say, this COVID may come to an end, hopefully sooner rather than later. It could appear again, and hopefully it won't. But the point is, plans need to be put in place that are based on an analysis, an honest analysis of how this country or any country has dealt with this very, very deadly pandemic. With that in mind, I'm going to hand over to Wendy to give the assessment of what I have to say and her own assessment. And there, of course, you can see those steps, which again will likely be sent over to you in some form. Thank you, Wing. And thank you.
I'll send this document to all of you, as you can see from the screen right now. So now I turn to Dr. Haynes, Wendy.
Hello. Hi, everyone. I'm kind of going in and out. I'm having a little bit of connectivity problems. So forgive me for that. One of the things that strikes me about Karim and Dr. Mike's comments is that the way that the two commentaries fit together. I would say that as we think about Dr. Mike's comments, that really the job that Bridgewater State did during this crisis really exemplifies some of those key points that were some of those key 10 points that were mentioned. So I just want to underscore a few things. I'm going to keep my comment short because I know we're behind schedule here. One piece of it is the notion of leader as architect. Karim used that, Dr. Ismaili, sorry, that's too familiar, use that term. And I think it's quite apt because particularly in crisis, it's important to have a structure that people understand, a process that's going to be followed, a way of making changes, feedback loops, but that role of the leader as social and organizational architect is really key to that. Another thing that strikes me from the comments is the importance of operating as a learning organization. That is, as Dr. Ismaili was saying, where an organization and the leaders in that organization and the participants have the capacity to reflect and learn some of the difficult lessons that may well have come out. Now that learning has to do both with the positive things that happen, but I would say even more so from some of the missteps or the things that were not adequately attended to. Dr. Ismaili mentioned the notion of the student experience and concerns expressed by students, especially for asynchronous offerings. Just as a bit of background here, for fall term, only about 8% of our courses had any kind of a face-to-face element to them. There were almost no courses that I'm aware of that were 100% face-to-face. The ones that had a strong face-to-face element had to do with the science labs particularly, and also with some of the performing arts. And even in that, if one is keeping safety first, then we have to start prioritizing how do we balance out the safety issues with the learning needs, and how do we make sure that both are addressed? So that's taking it in the higher education realm. But the fact is, as Dr. Krasanik was saying, these points will pertain to far more than just a pandemic sort of situation. It's actually, those are good rules, and I think considerations to live by, no matter the type of the crisis that's presenting. We may, in some situations, have a crisis of leadership. There's some indication of that in places around the world, including the United States. So the question is, how do we as individuals and organizations organize ourselves in a way that we can respond, learn from the situation, and do better? And I guess the final part of the learning, that kind of closing the loop, as we look back, hindsight being 2020, what were the early signals of an impending crisis that we could have detected earlier? We were really beginning to take some decisive action in March. Would it have been possible in any given crisis situation to have anticipated and been able to plan and act sooner than we were? So those are all things that I'd like you to include in your thinking on crisis management. And I'd really encourage you to look carefully at Dr. Krasanik's 10 points. I think they're really right on point. Again, not just having to do with this particular crisis, but the matter of crisis management in general. Thank you very much. And now, Wing-Kai, you may want to step in here too. I know that you and Dr. Jabbar are next up on the agenda. Thanks,
Thank you.
everybody. Great to see you.
Thank you, Dr. Wendy, for highlighting some of the ideas about how we apply learning and organizational framework to think about crisis management. After Dr. Krisanik talked about the process of crisis management. Now Dr. Jabbar Al-Abaidi and I want to take you to a broader context in the world and not just focusing on the United States. I'll ask Dr. Jabbar first to talk about his views, and then I'll follow up. Yes, we can see your screen.
Jabbar, you're muted.
Yeah. Are you speaking, Jabbar?
Jabbar, you're muted.
Yes, I had a little bit disconnection with the Wi-Fi. Anyway, I was. Thank you so much, Dr. Wankaito, and thank you for our leaders to engage our colleagues from the continent of Africa about our experience with COVID-19 and how we dealt with it, or we have been dealing with it. And so in light of the 10 points that Dr. Krisanik mentioned, and also the notes from Dr. Anis and what Dr. Ismaili mentioned, I want to just bring you to the global reality, and not just from Africa onward, but also in the whole world, and how we're doing in terms of COVID-19. And this is as of today, which is October 5th. And as you see on this interactive map, globally we have the numbers being really increased. 35,109,317 confirmed cases throughout the world, and this is a frightening number, considering some of these countries are advanced countries, and of course United States, our country, prides itself, unfortunately, to be number one, and then Brazil and other countries, India, of course. But for our African continent, you see it is really also the numbers. If you go to the map, like South Africa, 681,289 confirmed cases, 16,000 and 975 deaths. You go United Republic of Tanzania, and so I just you're going to see this map, and then you can keep it. This is from the World Health Organizations. They also, speaking of transparency, from whether it's health leaders, Ministry of Health, or whatever organization that deal with public health information, they don't, including, by the way, including the United States, they don't really provide the real numbers, unfortunately. So we can understand how we deal with these cases, because culturally, some of our countries in Africa and the Middle East, in Asia, when someone have COVID-19, is a kind of becomes a stigma on the family or on the tribe. So we need to understand as leaders, how to deal with this, and then probably massage it a little bit and say, this is a disease, this has nothing to do with the social status. And there is a case in point, the President of the United States now have, and his wife, the First Lady of the United States, both they have infected and they contracted the disease. So it's not really just for the poor or for the rich or advanced or otherwise targeted countries. It's all together. However, as a leader, you need to understand that, of course, poor communities, of course, always they will have the largest share from COVID-19. Can you move a little bit? Now, so this map is available for you. And so one of the concerns, some of the concerns are now actually published this week from the Global Strategies and International Studies, CSIS. They found out that it is imperative for African governments and international donors to increase and refine public health programs and funding, because we know that the African countries are really unable to provide what's needed in terms of the medical supplies and also medical services, whether in the cities or in the rural areas, and especially rural areas. The second concern is regional and international stakeholders should take care of the elderly, because it's found out that the elderly people, and the definition for elderly people, at least in Africa, is 60 years, and some of them 62 years old and older. So this kind of shifted the focus or the attention on other group of patients at the expense of what they need, the elderly people, and also the other diseases such as HIV/AIDS and TB, malaria. All these become secondary, and the focus is on COVID-19. And the end result, of course, all these combined together will really make the situation even darker in terms of how to deal with COVID-19. And so the challenges, in short, lack of resources, and as you know, the world is battling this situation. But again, for Africa, they need more resources, and I think Dr. Kirzani mentioned that, how we can do that in terms of providing global help, especially to develop underdeveloped the old language, and these countries, they need real help immediately. The second challenge is force shifting strategy. As I said, local government and donor resources, they went to the wrong really areas, instead of concentrating on where the service is needed. I know, of course, most of the time when you go to the African countries and other Asian countries, Middle Eastern countries, Latin American countries, you find cities and developed towns. They have probably some medical services but when you go outside that region, you don't find that. Border closures is another challenge. Lockdowns and border closures, of course, that prevent, of course, the flow of reaching the medical needs and also medical supplies to the country. So as leaders, you probably are aware of this, but this is, as global community, they should come to realize that other countries, that they don't have really the means, they need to get some help and immediately. And this is familiar, and you smile. I know we have a problem, although with mosquitoes, but the net campaigns now, the last report, it is being also disrupted. And of course, that will increase the infection in malaria and all the related diseases when it comes to mosquitoes. This is This is a challenge. We need always to keep it in mind, not because we have the current situation, unfortunately, the COVID-19, and then we somehow the other problems will be slip away from our attention. That will actually exacerbate the city and the situation and make it even more challenges. Childhood and infectious diseases. This report found out that children now, it's kind of, they don't really get the attention because, again, COVID-19 is kind of really becomes the magnet for everything, or the effort and the attention to do that. And then we forget about the children and also the infectious disease that they have. And so it is a call for the global partners, international partners, and especially for the United States and other countries in Europe to really pay attention to this and help the people in Africa. It's very important. And I mentioned this, the last one is elderly people. As I said, this is important. So 3 things that I would like to recommend. One is we need to be very active in terms, if we are in leadership position, we need to connect with our local local communities and get the information from them and see what they need in terms of COVID-19 and otherwise other diseases. Secondly, we should engage the NGOs in real work so they can also extend help or helping hand to the governments and also probably connect with their partners around the world to get the funds that the countries they need. The third one is the communication, and I think all the speakers they spoke about the transparency and communication is very, very important. Thank you so much.
Thank you, Dr. Jabbar. I think you reminded us that it's not just COVID-19 when we talk about crisis management. In terms of public health and other topics, there are a lot of things that we could also look into as well. And I wanted to just spend the last 5 minutes before we have the breakout rooms to quickly sum up some of the things that we talk about, and before we go into some of the breakout rooms. But before I do that, sorry about that. So I'm going to go to my screen over here. So can you see this? I think we're talking about crisis management today, but I think our focus is really to think about these 4 themes that we are talking about, both for today's sessions and for the next times that we're going to meet in the future weeks. One of the things that we talk about today is how do we change from a crisis management period to helping our organizations and our communities for the longer term. So these are the 4 topics that I think we all keep asking ourselves. So crisis management is just the first step, but we try to develop more resilient organizations and communities. And also we wanted to take advantage of any innovative opportunities at this time. And through this process, we try to develop our recovery and any changes that are necessary for our work. So for what we been talking about, I just wanted to quickly summarize what the main points are. In order to be a good leader or manager, we need transparency and accountability. I think that's the most important thing, that people have a lot of questions about our leaders because they are not transparent or they are not accountable to other people. We need some protocol for emergency and risk management. If you all, so then we don't have to reinvent the wheel. And of course, no one can really foresee the magnitude of this crisis this year. But it's important for us to think about whether your organization has a crisis management or risk management protocol. Are there people you would look into for help when there's a crisis and who would make the decisions. So decision making and effective communication, as everyone said, is very important, as is flexibility and adaptability in the process. You also heard about from Dr. Ismaili that we rely on the expertise and data-driven decisions, and that would affect our reallocation of our resources and our budget, because all these things have an impact on the economic well-being of our organizations and our people. As a leader, finally, I think we need to not just be clear in our decision making, but also have empathy. And as we all try to emphasize that, we emphasize the servant leadership qualities of the leaders. And that's particularly important during a period of crisis. And finally, we should be forward-looking and innovative as well. So I think this sums up some of the things we talked about today. And IREX, as you know, that they have done a series of leadership training as well. And they have covered these topics before. And they have different modules covering resilient leadership, grant writing, mapping public health crises, public health communication strategies, navigating a business in uncertain times, identifying market leads and gaps, countering disinformation about media and trusted sources, English as a second language toolkit, promote partnerships with US businesses, and food security in crisis. So they had these modules from July to September. I know that only a handful of you probably signed up for these modules and got the certificates from them. But if you did, you can share your experiences in the small groups discussion sessions so that we know that what you have learned from IREX. So our goal is not to repeat what IREX has done. They've given you some videos and something to study in these modules. But we wanted to do something else and focusing on our own experiences. IREX has also, if I could go to the other one. Okay. So I'm not going to share anymore. So I wanted to, before we go into the breakout sessions, I wanted to, let's see, I wanted to talk about what we're going to do in the breakout sessions. So I think we'll just divide it into 3 groups because we have a smaller number of people. And then our goal is to listen to your experiences. How does COVID-19 affect your work and life in your home country? As a leader and manager, how are you working with your colleagues to minimize the effects on your work? And what changes have you made to support your coworkers or your employees? And how can we support each other between the Mandela Network and the BSU Network with you in this period or in the future? Are there any practices or innovations that will be developed in your experience during this period of crisis as well? So we will talk about these issues, mostly listening to the 5 to 10 fellows we have here, about 10 fellows we have here. And before I do that, I wanted to actually ask Dr. Meyer, you have something to tell the group a little bit. So he has some very exciting opportunities for all of you to think about.
Thank you so much. And thank you everyone for being here. I can't wait to talk in the smaller groups. I'm currently working with a colleague at University of San Francisco on editing a book on case studies of social equity. So this will be mostly a textbook of case studies that classes can use to explore themes and issues of social equity. And in public and government nonprofit and government organizations. So I thought this would be wonderful if some of the Mandela Fellows would be interested in submitting some case studies and talking a bit about their experiences in creating social equity in either government or nonprofit organizations. So I'll put my email address in the chat box, and I'd be happy to chat more about what it means to write a case study. And if anyone has any questions, I'd be happy to answer them. but it would really just be wonderful to have a lot of different experiences. And I think that's what's wonderful about the Mandela Fellowship, is the diversity of experiences. So thank you so much.
Thank you, Dr. Maya. I think I will forward your document to them also. Yes, please write to Dr. Maya directly. So you'll be sent to one of the 3 groups right now. I'll see you back in about 15 minutes to 20 minutes.
Is seeing its second term of a 6-month period of being declared a state of national or public emergency. Perhaps now I want to do a little comparison between what I heard Mr. Ale from Ethiopia saying in comparison to what is actually happening here. So much as we're not happy, or I think a lot of Botswana are not happy with the fact that we have been declared as a state of public emergency for a further 6 months, the one thing that I should commend the leadership for is that they are engaging people from across board. Here in Ethiopia, it's the government that basically came up with their own strategies. They planned everything alone without getting the buy-in from, the private sector, from the public in general or at large. And so, they're not getting support because there is no buy-in from anyone. It's really just a single-handed, what word can I use? Effort by the government. Whereas in Botswana, the public sector is, they're quite involved, they're quite supportive, perhaps more financially than anything else, but the private sector is very, very involved. We have what we call Business Botswana, and they're getting people from all sectors in the private sector to be a part of the different or the various things that they put in place to try and curb the difficulties that we are facing in the country, especially as business owners or even just as employees. The other thing perhaps that I'd like to highlight about Botswana is that we've had several lockdowns, so that has really, really interfered with the learning system. However, tertiary education is doing quite well. A lot of the tertiary, I mean universities, so your BSUs, if you will, they're doing quite well. A lot of them are giving internet to their students. So even if they have been forced to go to their villages, as long as they have their cell phones, they have data loaded onto it that was helping them continue with their studies. But as we speak, a lot of institutions are back full time. So students are at lectures with their masks and so forth and so forth. Every now and again, you'll hear that an institution has closed down because somebody has tested positive and all of those kind of things. But in general, people are back in the workspace. Maybe just as well in the workspace, the one thing that I did highlight is that a lot of institutions have cut down on the number of people that work in an office at a given point in time. So if me and Dr. Mike share an office, then Dr. Mike works this week, the next week I work. So most people are working 2 weeks at home, 2 weeks from directly at the office. I think that's, I'll stop there.
Looks like Botswana is taking a very careful approach so far. And
it really, really is. I think it's really because we really don't have the resources. If it goes out of hand, we wouldn't be able to manage it. So they're trying to really curb the spread as far as possible. The numbers have been rising, but as I was saying to my group members, I believe that the numbers have been rising because we are also testing a lot more than we were before. But also maybe before I end, I should just highlight a few other things about Ethiopia. the one thing that Ale mentioned is that schools have been completely closed since April this year. So there's absolutely no learning. Students have had to go back home to their remote village. Unfortunately, they hadn't had internet available either. He also exclaimed that the power is unreliable. So the education system is really, really taking a terrible toll in Ethiopia. Yeah, I
Thank
think
you.
those were the important parts.
Yeah, so really good
Most
summary.
welcome.
So may I have a group number 2? Either the fellows or Dr. Mike and Dr. Jabbar can talk about that.
Sasha,
Yes, for sure.
please.
So, yeah. So captured a few things. The groups that were, let me just make sure the volume's up. Can you guys hear me? Okay, good.
Yes.
So Ethiopia was represented, Sierra Leone, and Eswatini was represented. And I'll just give kind of an overview, like overlap. Major adjustments, I won't say from where because it's each group, but crime is seemingly up, schools closed, students not in school for 7 months are really, really tough emotionally. Government had to take money and use reserve to kind of deal with COVID. So there's a lot of financial sort of, downfall. One positive component that came up was in Ethiopia in particular, money was raised a good amount to support elderly who were seemingly most affected by COVID. So that was a plus. And that's really all I have. So some of the same overlaps everyone's feeling.
So it looks like some countries, they're feeling the social effects of COVID-19 on the children and on education and on the common people as well. I'm sure that we can, is there anyone else in group 2 who want to add anything? So I know group 3 has a lot of different fellows from different countries. So maybe you can share some of your ideas. Jody, you want to, is there any fellow who wants to volunteer to share? Otherwise, you can sum up some of the things that's been said.
Yes, I can provide some if they would like to, they can. If not, I can give a little summary. Would you like me to give a summary?
Yeah, why don't you start with the summary and then
there was what I thought was interesting because a lot of the same things that the other groups were sharing were echoed in our group as well. But what I thought was really interesting was, is it Malay? I mentioned in her time where she's working she's from Ethiopia, but also living in Oman, is being a parent during this time frame and having her work life and working from home and being a parent of a small child at the same time and taking care of and teaching and being, that's a really difficult position. And I know that as a parent, because I have a teenage daughter and who's learning high school and being remote and learning from home. And Seth is also a parent of a little one and is a college professor. So it's because of COVID, we're blending these, worlds together and it's difficult, right? And so that was interesting to have that shared as well. And then also shared was working in Nigeria with marginalized populations. And you're not only dealing with COVID, but you also have to deal with all the other things that are, really important in life, such as food, water, shelter, right? And you're working with individuals who are facing, being human trafficked. So even though we have this huge issue of COVID, the regular things that we have to deal with on a day-to-day basis are still happening. And she was also wondering if anybody has information on working with donors to access clean water because they need that as well. So I thought those were really interesting stories that was brought up, and also broadband, accessing broadband and having that good access during this time frame, having the technology, good technology to work from home. And just to share, we're experiencing that even here in the US. My neighborhoods, we don't have good broadband, and our students here in our community don't have access to it all the time either. So it's happening around. And then one other piece that I thought was poignant was when you're working with giving support to the people that you work with, giving them the emotional and social support around funerals. You know, you have the people that your coworkers and their family members die or they pass away, and not being able to be there at their funeral, and not being able to support those people like you normally would. And there's a lot of that emotional piece, that social aspect is really important. And we're seeing that worldwide, that people are, really suffering, being isolated like that. And for both the emotional sad times, but also for the joy things like weddings and birthdays and things along those lines, but especially for a time of need like funerals. So those are some of the main pieces that came out of our conversation. So thank you all for sharing. Those are wonderful stories. Thank you.
Anything to add from folks from Africa and from South Africa and from Burkina Faso? Kumano, you were in that group, or do you have anything to add? Are you muted?
Yes, I was in that group, and I think Jody did a good work in summarizing it. In South Africa, as you know, we are the hardest hit country. We are now in level 1. We have a risk-adjusted strategy which has 5 levels of alertness. So we are now at level 1, which means basically everything is back to normal. The borders are opened. Although there's still a curfew, you can't be out from midnight until 4 a.m. and there's no alcohol sales during the weekend. But basically everything is back to normal. We are preparing for the second wave because the hospital admissions have reduced, and the quarantine sites are not being occupied. So there's a sense that we are doing well, but I think there's also a sense that we shouldn't be complacent because other countries have seen a second wave. So we are adjusting to what we call the new normal, to just get used to living with the virus because it's just around us. So we are opening the borders, we are going back to work in a normal way. The examples that the China was making, people are rotating, even at school, they've got a timetable that allows a certain group of students to come this week and the other groups come the other week and so on. But everyone is just trying to get used to life with COVID, because even if we get a vaccine, we're not going to be the first ones to receive it, It will be probably, yeah. So that's what's happening in this side of the world.
Mm-hmm. I know that Lorenta also said in Nigeria, she's trying to help while she's in Europe. Obviously, South Africa is dealing it quite well, but in West Africa, the situation varies a lot in different parts of West Africa. What do you think about Nigeria's response, Lorenta?
Yeah, thank you. So, in Nigeria, the situation is no different, but a little more because considering the population and most of the challenges that have been shared is cross-cutting, like students being home, not resuming school yet, particularly one of the aspects that I would think or that is visible as part of effect for COVID is the economic vulnerabilities it's creating, particularly in marginalized and secluded places. So like increased rates of poverty, and then people unable to access basic needs of life. And then I was trying to make an inquiry because we, in my own organization, the little group that we work with, Oxano Foundation, over the last 2 months, we are trying to see how we can help some of this community, particularly for community, to access safe water sources and sanitation. And I wanted to continue conversation with Dr. Kevin, if it is possible for you to link me up, because we made some new discovery after drilling the borehole in two marginalized communities. The water source, the water that was drilled from that particular community was fecally contaminated, as we took some sample for analysis and discovered a lot of staphylococcus and other bacterium was discovered in that water. So before drilling that borehole, they drink water that is very bad, that is not pure and unsafe. And this is part of what widening, what's part of what caused most of the diseases that was highlighted in the last presenter and doctor speech. So we are trying to see how we can contribute to creating a change in some of these communities. And we want to expand understanding on the best approach to ensure that we can be able to treat the water, because we believe that when water comes, everything changes. Water, food, those are some of those vulnerabilities that I feel, in addition to COVID, are worth giving good attention, because more children are dying from those things than even the coronavirus. So yeah, so
Yeah,
I'm really
definitely. We
grateful
can
if you
connect
can
you.
link me up with, I think his name is Dr. Kevin, who gave us a lecture during our time, 2018 Mandela Washington Fellow, on access to clean water and sustainability and sanitation. So I would like to share information further with him.
I'll connect you to Dr. Kevin Curry about that. I'll also connect you to our 2019 fellow Ismail from Botswana. He's also working with water management and treatment as well. So Norenta will be in touch. So last but not least, there are fellows from other parts. Any final comments from Sierra Leone, Burkina Faso? Is it Badi, you from Mali? And Eswatini, of course, Kani, and yeah, Nadaj, now you're in DC. So I know that in smaller countries, obviously there are two situations. One is that probably they will have less stringent measures to control it, because they probably would try to go back to normal as quickly as possible. On the other hand, it's also a tricky situation if a smaller country cannot control the virus, and it will probably have less means to deal with that. Um, but anyway, I do think that in bigger countries like Nigeria and South Africa, they have to and Ethiopia, they have to do a good job in containing the disease, so fewer people will be affected by that. Um, I do understand that the social effects are bigger for work, for education, and for resources and services. Um, but as leaders, I hope that all of you can all talk about your organizations and next time if you are able to join us again, we'll go into a little bit more details about your work. And in this series of workshops, we try to focus on topics that concern the United States and also concern the world. So COVID-19 is the first topic. The first topic is the racial and economic crisis that the U.S. is facing right now. So we'll talk a little bit about that next time, about racial crisis, racism, and inequalities and colonialism, and the effects, the lingering effects on our countries, and whether we are actually turning the corner or we actually still facing all these problems. Um, and then finally, we'll get into a little bit more specifics about your organizations and the management aspects. And we will use our own Certified Public Managers Program, CPM program, as an example to talk about how we deal with that kind of day-to-day work. So let me invite you to two more workshops in November, on November 9th, and also on December 7th. but I may change that to 1 p.m. so more people can sign in if they are an hour later instead of starting from 12. But I know that you're all busy finishing work and whether you work at home. So can I ask you whether those of you who are working, are you going to your company or doing the regular work, or are you working at home? Bukhari, you want to say something?
Yeah, for my side, currently I work 1 week in office and another week at home, because you have 2 in the office and you have to plan to not be 2 in the same office.
Okay, so you alternate 1 week in office and 1 week at home. And Kumano, are you working in the office now? Working at home?
Always here at home.
You're working at home. Okay, so there's still a period of adjustment.
Some days I work from home and some days I work in the office.
Oh, I see.
We alternate, yes. 3 days a week in the office and 2 days at home. Alternate. There are weeks I do 3 days at home and 2 days in the office. So
I see. And anyway, I think that's just one part of the adjustment. The other part is really how does it affect the economy, and how does it affect the education, and how does it affect our day-to-day life. Any final comment from Dr. Mike?
No, I would just like to say, Lachani, I'll respond to your questions on Facebook Messenger. And if anyone has any questions regarding my presentation or issues related to crisis management, please don't hesitate to email me. I'll be happy to get in touch with you and respond. Although I think Dr. Wing is going to, I mean, the whole session is recorded, and I think he may even send out my presentation as an attachment. But anyway, it's out there. Happy to respond to anybody. And Lachani, I'll talk to you soon.
It's nice to see those of you who are able to make it today. So if you, in each of your cohort, if you have any suggestions about any time or any topic that can help to get more people sign up for this, so we can, meet more friends, that would be great. So I welcome all your suggestions. If you want to suggest a different time or different format, and I welcome your suggestions, so that we have more people who can interact with each other. So if you also want any contact, again, the mailing list I sent, the email I sent has everyone's emails in it. So everyone should have everyone's contact. Thank you so much for this time. So next time when we meet, it will be on November 9th. Have a good month in October.